If arthritis pain makes everyday tasks challenging, research suggests 3 specific beverages may help support your body's natural anti-inflammatory response. I'm going to share evidence-based options that have shown promise in clinical studies for managing joint discomfort alongside proper medical care. Before we dive in, a quick note. This information is educational and not personalized medical advice. Arthritis management should always involve your rheumatologist or healthcare provider, and these beverages complement rather than replace your prescribed treatment plan. Joint inflammation drives the pain, stiffness, and swelling that characterizes arthritis. Your immune system releases inflammatory compounds called cytokines that attack joint tissue. Over time, this chronic inflammation damages cartilage and bone, while medications target these pathways directly. Certain plant compounds and beverages have shown potential to modulate inflammation through complementary mechanisms. The key is understanding which drinks contain bioactive compounds with documented anti-inflammatory effects. Not every healthy beverage impacts joint inflammation, and some popular options lack solid evidence. I've analyzed the research to identify 3 beverages with the most compelling data. Does this sound like information you've been searching for? If you're dealing with arthritis, pain, or supporting someone who is, comment joints below so I know you're following along. Let's start with the first beverage, green tea.
Specifically?
We're talking about true green tea from the Camellia sinensis plant, not herbal infusions labeled as tea. Green tea contains a polyphenol called EGCG, epigallatitin galate, that researchers have studied extensively for arthritis. This compound works at the cellular level to suppress inflammatory signaling pathways. Think of it as turning down the volume on your body's inflammation response rather than switching it off completely. A study published in the Journal of Inflammation tracked participants with rheumatoid arthritis who consumed green tea extract daily for 6 months. The research team measured inflammatory markers in blood samples and found modest reductions in C-reactive protein, a key inflammation indicator. Participants reported gradual improvements in morning stiffness, though individual responses varied significantly. What makes EGCG particularly interesting is its mechanism. Your joints produce enzymes that break down cartilage during inflammatory flares. EGCG appears to inhibit some of these destructive enzymes, potentially slowing cartilage degradation. This doesn't reverse existing damage, but it may help preserve remaining joint tissue when combined with standard care. For practical use, aim for 2 to 3 cups of properly brewed green tea daily. Steep for 3 to 5 minutes in water just below boiling to extract the beneficial compounds without excessive bitterness. The catechins in green tea are sensitive to heat and light, so avoid oversteeping or microwaving. One important caution: green tea contains caffeine and can interact with certain medications, including blood thinners. People also experience stomach upset on an empty stomach. Always discuss with your doctor, especially if you take anticoagulants or have caffeine sensitivity. If you're finding this helpful and want more evidence-based content on managing chronic conditions naturally alongside medical care, hit that subscribe button. I analyze new research every week to bring you practical, science-backed approaches. The second beverage on our list is Tart cherry juice, and the evidence here is quite compelling for certain types of arthritis. Tart cherries, specifically Montmorency cherries, contain high concentrations of anthocyanins. These pigment compounds give cherries their deep red color and possess potent anti-inflammatory properties. Anthocyanins work differently than EGCG. They inhibit COX enzymes similar to how some pain relievers function, but through a natural dietary source. Multiple clinical trials have examined Tart cherry juice for osteoarthritis and gout. One notable study at the Oregon Health Science University gave participants 8 ounces of Tart cherry juice twice daily for 6 weeks. Those drinking the cherry juice reported meaningful reductions in pain scores compared to placebo, particularly for osteoarthritis of the knee. The gout research is especially interesting. Gout is an inflammatory arthritis triggered by uric acid crystals in joints. Data from over 600 individuals showed that cherry consumption was associated with a lower risk of gout attacks. The anthocyanins appear to help reduce uric acid levels and decrease the inflammatory response when crystals form. Here's what matters for practical application. You need actual Tart cherry juice, not sweet cherry varieties or cherry-flavored drinks. Look for products labeled as Montmorency Tart cherry juice with no added sugars. The typical effective dose in studies ranges from 8 to 12 ounces daily, split into 2 servings. timing can matter. Some people find taking it with meals reduces any digestive discomfort. The effect builds gradually over weeks rather than providing immediate pain relief, so consistency matters more than perfect timing. Now you're past the halfway point, and if this information is landing well, let me know with a quick comment. Here's where things get even more practical, because this next beverage is one you can easily make at home and customize to your taste preferences. The third evidence-based option is turmeric beverages, often called golden milk or turmeric lattes. The active compound here is curcumin, one of the most researched natural anti-inflammatory agents for arthritis. Curcumin's mechanism is remarkably complex. It modulates multiple inflammatory pathways simultaneously, including NF-kappa B, a master regulator of inflammation in your body. When activated, NF-kappa B triggers a cascade of inflammatory responses. Curcumin helps keep this pathway in check. A meta-analysis published in the Journal of Medicinal Food reviewed 8 randomized controlled trials involving over 600 arthritis patients. Across these studies, curcumin supplementation led to significant improvements in pain and physical function scores. The effects were most pronounced for osteoarthritis and rheumatoid arthritis when participants took curcumin for at least 8 weeks. The challenge with curcumin is bioavailability. Your body doesn't absorb it efficiently on its own. This is where the beverage preparation becomes crucial. Combining turmeric with black pepper dramatically enhances absorption. Piperine, the active compound in black pepper, can increase curcumin absorption by up to 2,000%, according to pharmacokinetic studies. Fat also improves curcumin uptake since it's fat-soluble. Traditional golden milk recipes include coconut milk or regular milk for this reason. Fat carries the curcumin through your digestive system more effectively. Here's a simple evidence-based recipe. Heat 1 cup of milk or non-dairy milk alternative. Add 1 teaspoon of ground turmeric, a 1/4 teaspoon of black pepper, and a small amount of healthy fat like coconut oil if using non-dairy milk. Some people add cinnamon or ginger for flavor, which also have mild anti-inflammatory properties. For therapeutic effects, aim for 1 to 2 cups daily. The golden color might stain mugs and clothing, so handle carefully. Some individuals experience mild digestive changes when starting turmeric, so begin with smaller amounts and increase gradually. Important safety note: turmeric can interact with blood thinners and may affect blood sugar levels. Anyone taking anticoagulants, diabetes medications, or preparing for surgery should consult their doctor before regular turmeric consumption. Now let's talk about implementing these beverages into your actual routine, because knowing about them doesn't help unless you consistently consume them. Start with 1 beverage rather than all 3 simultaneously. This lets you assess how your body responds and identify which works best for you. Give each option at least 4 to 6 weeks before evaluating effectiveness, since anti-inflammatory effects build gradually. Consider your existing medication schedule. If you take morning arthritis medications, you might space these beverages a few hours apart to avoid any potential interactions. Your pharmacist can provide specific guidance for your medication regimen. Track your symptoms systematically. Note pain levels, joint stiffness, duration, and functional limitations in a simple journal or app. This helps you and your healthcare provider assess whether these dietary additions provide meaningful benefit alongside your medical treatment. Hydration matters too. These beverages add to your daily fluid intake, which helps maintain joint lubrication and overall health. Balance them with plenty of plain water throughout the day. Some people rotate between these options rather than drinking the same beverage daily. There's no research proving rotation is superior, but variety might improve long-term adherence and ensure you benefit from different anti-inflammatory compounds. Cost can be a practical consideration. Green tea is generally the most affordable option. Tart cherry juice is more expensive, especially organic versions. Making golden milk at home is cost-effective compared to prepared turmeric supplements. Remember, these beverages work best as part of a comprehensive arthritis management strategy. They don't replace anti-inflammatory medications, physical therapy, appropriate exercise, weight management, or other treatments your doctor recommends. Think of them as supportive additions that may enhance your overall approach. Individual responses vary significantly based on arthritis type, severity, genetics, and other health factors. What helps one person substantially might provide minimal benefit for another. This is why medical supervision remains essential. You need professional guidance to determine what combination of treatments works for your specific situation. Comment ready if you're going to try incorporating one of these beverages this week. Track your experience and discuss it at your next medical appointment. Your healthcare provider might have additional suggestions for optimizing your arthritis management plan. In my next video, I'll reveal the 5 daily habits that research shows can reduce inflammatory markers throughout your body, which directly impacts joint health and arthritis progression. These go beyond diet to include movement patterns, stress management, and sleep optimization that many people overlook. The 3 beverages we covered today, green tea with EGCG, tart cherry juice with anthocyanins, turmeric beverages with curcumin, all have documented anti-inflammatory properties in clinical research. They represent evidence-based options worth discussing with your rheumatologist or healthcare provider as potential additions to your arthritis management plan. Remember, this video provides educational information, not medical advice for your specific situation. Arthritis is complex and highly individual. Work closely with your healthcare team to develop a comprehensive treatment approach that addresses your unique needs and circumstances. Never stop or change prescribed medications without professional guidance. If you found this analysis helpful, give it a thumbs up and share it with someone managing arthritis. Make sure you resubscribe for more evidence-based health content. Cuts through the hype to focus on what actually works according to research. Thanks for watching, and I'll see you in the next video.